Hello, my name is Amy. I'm going to be your nurse today. I'm going to wash my hands. And can I see your ID band?
Sure.
Can you tell me your first and last name?
Jennifer Huffman,
And your date of birth?
131XX.
And do you have any allergies, Miss Jennifer?
No.
Okay, wonderful. The doctor has ordered for you to have a sterile dry wound dressing change. Have you had one of those yet?
Mm-mm.
Okay, well, I will explain the procedure as I go through it. Is that okay with you?
Yeah, that'd be great.
All right, first things first, I'm going to put on some clean gloves. I already gathered my supplies and I'm going to bring a trash can close. I'm going to lift your bed here. And since it's a sterile procedure, we're going to be lifting it about to my waist height. Are you having any pain at this time?
Not really.
On a scale of 0 to 10, how bad would you say that pain is?
Maybe a 2.
Maybe a 2. Okay, is that tolerable to you?
Yeah.
When I feel around this wound, does that increase that pain?
A little bit.
Is it still tolerable?
Oh, yeah.
On a scale of 0 to 10, when I touch it, how bad is it?
Maybe a 3.
Maybe a 3, but that's going to be comfortable to you.
Yeah.
Okay. So what I'm going to do is I'm going to put a waterproof pad underneath this wound site. I'm going to get a biohazard bag, and I'm going to put that easily accessible to me, so I'm going to put it right here over the trash can. I'm going to have a measuring device as well as some cotton tip applicators to check that wound site. Now what I'm going to do is I'm going to take off this dressing first. I'm going to pull the tape towards the inside of the wound. And as I take this off, I'm going to look at this dressing and I'm going to be looking for the color of the drainage. And I'm going to be looking for, is it sanguinous, serosanguinous, or serous? I'm going to look for the amount on the dressing and I'm going to identify if there's any odor. Then I'm going to put this in the biohazard bag. Now I'm going to check the size of your wound here. I'm going to open up this cotton tipped applicator, and on this wound I'm going to measure the longest point, and I'm obtaining 13.2. It's really important that we identify exactly what it is. So it's 13.2 centimeters, and I'm going to get the longest width here, and that is going to be 6.1 centimeters. And then I'm also going to obtain that depth. And now on the depth, I'm getting 0.6 centimeters. I'm going to check, and I don't feel any tunneling around the site. So I put that into the biohazard bag. At this point, I'm going to take off my gloves, those clean gloves. I'm going to wash my hands again. And I'm going to prepare my sterile field. And as I prepare my sterile field, I'm going to gather these supplies. I don't need that any longer. I'm going to get my tape, and I'm going to need 5 pieces of tape. 1 for each side of the wound, and then 1 I will write the date, time, and my initials on it. So I'm going to write the date, the time, and my initials on that 5th smaller piece, and I'm going to put the tape to the side. I'm going to open my basin away from me to keep my sterile field. I'm going to take my sterile drape out, noting which side I'm touching as the outside, and ensuring that I'm only touching that 1-inch margin not crossing my sterile field, coming around. We will not be irrigating, so I can take this out, ensuring that I stay away from that sterile field, coming around, going to take the lid off. I'm going to lip my solution, pour a little bit, and immediately put my lid back on, coming around that sterile field. I'm going to open up each of my sterile gauze. This is going to be my Tefla dressing. This will be the dressing that will actually go on the wound at the very end. Coming straight off that sterile field, again coming around. I'm going to open it up and I'm going to put it onto my sterile field. And with this dressing, we are going to need 7 gauze. So as I open each of these gauze, ensuring that they're landing inside of that sterile field. I'm also going to need to put my culture into my sterile field. So I'm going to open up my culture. Okay. We're going to make sure we drop it right in the middle there. And come immediately off our sterile field. I have all of these things. I can put that around here. Make sure I have enough room to open up my sterile gloves. Taking that packaging out. Coming back here, not turning my back to that sterile field, and ensuring that my gloves case does not go over that sterile field. I'm going to take the first one, I'm going to pinch, pulling that sterile glove onto my hand. Okay, and then with the second one, I'm going to scoop my fingers underneath, ensuring that that does not go over that sterile field. Get that second glove on. And now I may pull from the inside and have them up. I'm going to leave that where it is. I'm going to take a gauze. I'm going to dip it in my saline, wring it out, and we're going from the middle of the wound in one place. Middle. And then toss, not going below my waist with these sterile gloves. Get my second gauze. I'm going at the top in a dabbing motion. Toss. I'm going to dip again at the bottom, toss. I'm going to dry the same way from the inside out. Inside, toss, top, toss, bottom, toss. Now I'm going to get my culture. And with my culture, I'm going to turn it in a circular motion. I'm going to go in a zigzag across the wound, attempting to get all of the stuff that I can from that wound. Take off the lid off of that container, inserting my swab into the container, closing it, and put it somewhere where we can label it after. Because I'm still sterile, I cannot label it at this time. I'm going to take that inner gauze, because this is a deeper wound, I'm going to fluff that gauze, put it in the inside of that wound, taking my Teflon dressing, and I'm going to fold it to the size of the wound, ensuring that the part that's actually on the wound is nice and straight. I'm going to put my tape on, tear that excess tape that was touching the table. And then that last piece that had my initials, date, and time is going to go on the very top. Now, how are you doing, Miss Jennifer?
I'm doing okay. That wasn't so bad.
That wasn't so bad. Well, I'm happy to hear that. I'm going to put this stuff to the side. I'm going to put you down into the lowest position. Is that going to be comfortable for you?
Mm-hmm.
Okay. Is there anything else I can do for you?
No, I think I'm okay.
Okay, I'm going to lower you down, and then I'm going to take off my gloves and label my specimen. And what I need to label that wound specimen with is your date, or your name, first and last name, your date of birth. I need the current date and time. I need my initials, as well as I need where this wound culture came from, which is going to be your right upper leg. And then I will send this off to lab. Thank you very much.